So we were here. What will be the dose? What should be the dose or the folate? So that is important. Okay, that has been asked. Only the dose that has been asked was the folate. Okay, actually it is the. So I will tell you that it is the actually 400 to 800 microgram per day. So that is standard dose for folate. To prevent neural tube defect, you should give folate to every pregnant lady. So what is the standard? Actually, you will give the folate 1 month before pregnancy and you will continue until 3 months. Okay, that is the first trimester. Okay. Then we will discuss the drugs, okay, that can increase the risk of the actually neural tube defect. The drug, the most important drug that will alter the folate metabolism. They will affect the folate metabolism. The most common can be the anti-seizure drug. Like first one is the your valproate. Valproate can that. Then is the carbamazepine. Yes, methotrexate, carbamazepine. Okay. So first we have discussed the anti-seizure drug. Then the cancerous drug can be the methotrexate, can that, and sulfonamide can that, sulfonamide, okay, trimethoprim, okay, try TMP, that can also cause that, okay, all these drugs can alter the folate metabolism. So you have to be sure if the pregnant lady is on that drugs, so you have to be sure that, okay, you will check the AFP, okay, or you will increase the dose of the either. If the lady is pregnant, then you will actually change the drug uh, from the drug that will causing the neural tube defect to an alternative. Like if the lady is on the valproate, you can shift to the levetiracetam if the lady is pregnant. And second point, you will increase the dose of folate. So that's all for neural tube defect. Okay. Next is your holoprosencephaly. Next is your holoprosencephaly. So here you can see that very important. Okay, holoprosencephaly. It is a failure of forebrain to divide into two cerebral hemisphere. Normally, forebrain will divide in form the two cerebral hemisphere. If that does not occur, there you will have the holoprosencephaly. Here you can see that prosencephalon. Here, if you go back, you can see that prosencephalon will divide into telencephalon and diencephalon. So holoprosencephaly, here prosencephalon will not be divided. So next I am discussing the holoprosencephaly. Here is the failure of forebrain to divide into cerebral hemisphere. Normally suppose that is one cerebral hemisphere that will go into two cerebral hemisphere, okay, like that. But if that doesn't occur, you are having only one cerebral hemisphere, that will be holoprosencephaly. The question that is important for holoprosencephaly, actually it is the field effect. We will discuss in the future lecture what do you mean by field effect. It is the developmental field effect. Okay. Due to that, there is a failure of the forebrain to divide into cerebral hemisphere. Okay, it usually occurs at a 3 to 4 week. It is associated with SHH mutation, that is a sonic Hickok gene. Okay. Then may be seen in Tau syndrome and fetal alcohol syndrome. Third important one can be that it is the retinoid. If the patient is taking the retinoic acid, you can write in your book the retinoic acid. If the actually patient, you can say taking retinoic acid, that can be led to the holoprosencephaly. So there are three causes: tau, fetal alcohol, and retinoic acid. Okay, so that's all for these association are important. The most important can be alcohol. Okay, there were questions upon the Tau syndrome, the trisomy 13, and then the fetal alcohol syndrome. But another association is the retinoic acid. So here it present with midline effect. There can be monoventricle, fuse, basal ganglia. Okay, basal ganglia is fuse. Okay, then cleft palate. Okay, hypotelorism, cyclopia, eye will be single. Okay, proboscis, increased risk of pituitary dysfunction that lead to the diabetes insipidus. What is the actually spectrum of holoprosencephaly? It can be cleft palate, mild to severe. Like it can be the median cleft or cleft palate and lip. It can be single nostril, nose. Mean the nostril of nose can be single. Then can be hypotelorism. Eye will be closed or single. Okay, it can be even the single center orbit can be there. Okay, so there are multiple variant or spectrum of the holoprosencephaly. So what do you mean by cyclopia? It is a one eye. Cyclopia is a one eye can be present in the forehead. Can be present on the forehead. Okay. So mnemonic for the former Pakistani student is that actually that is rubbish one. Okay, I will not discuss here. Then is a license actually. Actually, the mnemonic is that the tau alcohol. First is the first mnemonic. First point is pilau. Pilau is mean it is for alcohol. Mean you will give alcohol to someone. Then is the okay. First is alcohol. Then is the retinoic acid. Okay, that is rat. Then is 13. A 13-year young patient. Okay, the name was rat. That is taking the alcohol. Okay, so that is just a. You can also make your own mnemonic, but you have the main point is that you have to cram 3 association of that. Tau syndrome, alcohol, and retinoic acid. Okay, by any way, but we should have to cram 3 association of the holoprosencephaly. Then in the lysencephaly, okay, with a failure of neuronal migration, you will have smooth brain surface that lack the sulci and gyri. Here you can see that there is no dip and okay, so associated with the microcephaly, facial anomaly, and hydrocephaly. Okay, so that's all about today. Tomorrow we'll cover the rest of all. Okay, we will try to cover in one lecture. If you have any question, you can ask here. Okay, the first question the in previous lecture the Roma was asking is for diabetes, how the diabetes associated with the neural tube defect. Actually, here is the issue with the insulin. Insulin cause the altered the fluid metabolism, I think so. But I know Roma knows about that. So what is the answer?
Yeah, actually, I Google it, and it says that the balance between proliferations of the cells and apoptosis is disrupted by hyperglycemia. That's why it causes a neural tube defects.
Okay. But we'll see. I will check by another source. I will clear from. I will tell you from tomorrow. Okay.
Okay, thank you.
Okay for today. Tomorrow we will continue the second demos lecture on the biochemistry and the also on the